So let's look back at the technology in more detail. So again, when we refer to the dual electrosonic technology, we talk about sonophoresis and iontophoresis. So first of all, Dr. Des is very much a believer in preparing the skin before treatment. He understands the obstacles that the skin has in terms of optimizing penetration of topical actives. So the goal of Environ is really to bypass the barrier to safely and effectively penetrate the skin. And we can do this or achieve this if we follow the proper treatment protocols. Again, Environ recognizes that simple topical application of skincare is going to give you results, but not the best results. They know beauty goes deeper with revolutionary skincare technology. So let's look at the structure of the skin and some of the factors that impede penetration. First of all, when we look at the skin here, we have the epidermal layer, which is about 0.1 to 0.2 millimeters in thickness. But it actually isn't the real protector of the skin. Yes, we have our skin cells here, we have the Langerhans cells, which help to fight foreign invaders and bacteria, but it's actually the stratum corneum, the thin layer on the top, that acts as that protective force. And the stratum corneum is only 0.1 to 0.2 millimeters thick. So it's a very, very thin layer. And it's constantly being subjected to influences that may compromise it, such as harsh weather, harsh cold and wind, products that are too aggressive for the skin, many environmental influences. So the stratum corneum is very important, not only to protect, but also Environ understood how we need to penetrate this protective barrier because it's the force, again, that protects all the layers. So some of the factors that prevent active penetration include oily residue, excessive keratinization, and the cell walls. Going back to oily residue, your skin, of course, needs lipids or microlipids in order to give it nourishment. But when there is an excess of oily residue, we know that the oily molecules actually impede the absorption of more aqueous formulation. So again, oily residue, especially in someone who's more combination or oily skin type, this will actually act as a barrier for active penetration of ingredients. The second is excessive keratinization. So when you have a lot of dead skin cells on the surface of the skin and they haven't sloughed off, maybe the client has not exfoliated, maybe they're more mature and the renewal and regeneration process is slowing down, we get dead skin cells on the surface that again block the great actives from our serums and creams from doing their job. And finally, we have our cell walls. So our cell walls are designed to be permeable, but their role is to accept nutrients and oxygen and water to keep the cells healthy. But it's still very hard for these larger molecules to penetrate and feed the skin. So keeping those three contributors in mind, how can we counteract this obstacle? So here, again, we see our lipid bilayer. We know that we can change the skin through topical application of products, but how can we really improve and rejuvenate the skin? How can we really get adequate ingredients into the skin? Well, the problem is, as mentioned in the previous slide, the skin barrier prevents active penetration. It limits the amount of active ingredients where they need to go. And so how can we overcome this? So let's talk about the best methods for promoting product penetration. And in our first slides, we do see some effective methods, but when we come to our next slide after this, you'll see why Environ's technology is so powerful. So as mentioned before, topical application gives some results, but only 0.1 to 6% of those actives actually penetrate the skin. Next, we have occlusion. So for example, using something like a rubberized mask or alginate mask. for 20 minutes. This is going to give us the penetration equal to ultrasound. Next, we have ultrasound. This gives us 1 to 2 times better penetration than our previous applications at a frequency of 1 to 3 megahertz for 20 minutes. And then we can step that up and look at galvanic. So galvanic offers 2.5 to 3 times better penetration when the active pole is in contact with the skin and applied for 20 minutes. But when we look at the technology behind Environ, and we look at the power of pulse field iontophoresis, low frequency sonophoresis, and microneedling technology, with pulse field iontophoresis, we get 4 times better the active penetration of products in 20 minutes. Low frequency sonophoresis, 40 times better the product penetration when combined with pulse iontophoresis. So when we have our dual probe technology at a frequency of 22 kilohertz at 15 seconds. Keep in mind at 15 seconds, that means we're working the probe or using the sonophoresis probe for 15 seconds in each point before we glide it or overlap to our next destination on the skin. And finally, we know that we get the best penetration with microneedling. Again, Dr. Des is really the pioneer behind microneedling. He's quoted in many medical journals and aesthetic textbooks because with microneedling, again, we create microperforations which allow for the active ingredients or the fertilizer for the skin to quickly penetrate, absorb, and do their job. So really, Environ, its protocols and treatment encompasses all of these elements. First, we have the low frequency sonophoresis. This creates cavitation. So earlier in this presentation, we talked about cavitation being those vibrating pockets. So sonophoresis creates those sound waves, which creates vibrating pockets between the cells, which then allow those active molecules to penetrate the skin. With pulse field iontophoresis, we ionize the molecules. So again, we know certain molecules such as collagens or high molecular weight hyaluronic acids, they would only sit topically on the skin. So how can we take certain molecules, break them down so that they penetrate at a deeper level? Microneedling, as mentioned, this is going to create microperforations in the skin or microchannels for a very quick and effective penetration of all actives used. So in this particular image, we see the use of the cosmetic roller, the 14 karat gold roller, which is a 0.2 millimeter needle depth. But now with the DF3 being bundled with the InnoPen, we can use the InnoPen at a 0.1 or 0.2 millimeter needle depth to prep the skin before numbing cream. And after the numbing cream has effectively done its job, which of course this pre-needling will accelerate the numbing cream time. So after approximately 20 minutes, once we remove the numbing cream, we can go right into medical needling. And here we can gauge our needle at 0.5 to 2 millimeters. And finally, we have the dual electrosonic technology, which improves the cavitation even more so than just using sonophoresis. So if you forgot what dual electrosonic technology is, that's when we pair sonophoresis and iontophoresis into one probe at one time. But if anybody has a contraindication to iontophoresis, we can switch that modality off. So let's just refresh quickly on low frequency sonophoresis. Again, this is creating those waves or microscopic vibrating pockets in the lipid bilayers of the epidermis. These pockets then form cavitation, which allows molecules to penetrate the upper layers of the skin more effectively. So it helps to bypass that barrier or the stratum corneum. So how does this technology work? Well, this slide's going to have a little bit of a visual, so keep your eyes open. First, the stratum corneum is the main protective barrier. It prevents the penetration of molecules due to the ordered lipid bilayers found in the skin. If you look at the top portion of this graphic, you'll see that sort of pan shape with the sonophoresis emblem. And this shows you what happens from 0 to 15 seconds as these sound waves are penetrating and creating cavities or cavitation in the skin for the delivery of the actives. And here we see the actives coming down those channels. We then overlap to the next area on the face, and we continue to create cavitation for the next 15 seconds and deliver those active ingredients. So on and so forth. Again, we often do sonophoresis anywhere from 15 minutes. We can do it up to 20 minutes. We always overlap and we create cavitation to deliver those essential ingredients. So a few quick facts for review. Low frequency sonophoresis does not use current, it is sound waves. Sound waves create the cavitation of the skin cell membranes. The serums do not need to be ionizable or water soluble. And this is also important to note when we're performing sonophoresis with Environ. We have our serum selector, and the serum selector in our learner workbook will show you what serums you can use in professional treatment based on skin type and condition. And finally, it's important to note that even for several hours post-treatment, the skin remains permeable and still is accepting or absorbing those active ingredients we delivered in treatment. There's not a lot of contraindications for sonophoresis. Most of them are ear-related, and a client should always check with their physician if they're concerned. But the main contraindications are ear damage, ear infections, hearing implants or hearing aids. Often the hearing aids can be removed, and tinnitus, which is the ringing in the ears. What I like to tell my client before I start treatment is they may hear a little bit of a high-pitched noise, not when you're doing the treatment, for example, on the forehead or the lower cheeks, but as you get closer to the ears or in the temple area. So gauging the expectation from the get-go is always super important. How do we perform sonophoresis? Well, if we look at our face, we can break it down into a map or a zone and symmetrically. So we can treat our face section by section. Starting, for example, on the right-hand side, we can work from the forehead always downwards. So we would work from the forehead to the upper cheek, down to the chin and lower jaw. We can then work over the upper lip and start on the other side or the left-hand side, again from the forehead down, making our way to the lower chin and jaw. Our neck and décolleté would be last, and not all clinics always offer neck and décolleté. Some would offer this as an add-on or additional service charge. But the philosophy behind this is, again, we're treating the face section by section. We always use the probe in each section for 15 seconds before we glide to the next region with a slight overlap. And of course, we're going to use that probe with one of our selected serums on the serum selector. It's also really important to remember, don't paint the whole face with that serum using your brush from the get-go. We always just apply the serum in the area that we're working on because it does absorb quite quickly. And then when we move to our next section, we pause the probe, reapply our serum, and continue. Here's an example of working on the eye area. So this shows you how many probe placements you would have, so 12 to 16 positions approximately. We know everybody's anatomy is a little bit different. So this region above the upper eyelid would take approximately 3 to 4 minutes. So that was sonophoresis. Now let's review iontophoresis. So field iontophoresis is our second modality in treatment. And here it's a non-invasive method where we propel high concentrations of a charged substance using a small electrical charge. And this sort of technology is not new. It's been around and proven for decades. This is also in the treatment where you're going to use your ionto output, again to a maximum now of 0.5 milliamps. And you're going to use your conductor or your conductive methods, whether that be the alginate mask or the haze gauze. We know our crocodile clips will attach to either. Okay, so and again, your client has the choice of whether they want to use the handheld rod, which they can hold in their hand, or actually they can place it under their armpit. Or you can use the rubber pad, and the rubber pad can be placed with conductive gel under the scapula or a meatier area or fattier area on the back. So how does iontophoresis or pulse iontophoresis work? What is the technology here? Well, first of all, before we use the technology, we are going to apply a water-based gel that contains ionizable and non-ionizable molecules. So in Environ, we always refer to our professional vitamin A application as our professional vitamin A step-up system. And if you look at your serum selector chart, you will have 4 levels. For someone new to the brand, we always start with the treatment gel. So we can apply this all over the face and neck. And we can graduate them in time to level 2, 3, and then 4. So again, level 1 would be your treatment gel. We step up to A and C, then A, C, and E, and eventually up to your retinol level 1 and 2. So again, before we actually turn on the technology, we apply the appropriate vitamin A treatment. And when the power is switched on, the molecules begin to ionize. A negative charge is used to drive the negative ions away from the negative pole, whereas the positive ions are attracted to the negative pole. When the electrical pulse stops, the ions associated before that will be reionized by the next electrical pulse. Remember, successful ionization doesn't start until after the 8-minute mark. So that's important to note in order to achieve deeper penetration. And this will continue for a total of 20 minutes for optimal results. Some of the facts behind iontophoresis. First, we need to combine water-based product that conducts electricity. So the molecules must be water soluble. The correct polarity must be selected as per the manufacturer's instructions. So Environ and Skin Health Canada has various protocols, and in most cases you'll be using a negative polarity, but there are a few protocols where you will use a positive polarity. You also need a conductive medium, so you will choose either the haze gauze or alginate mask. We know with the alginate mask you get better occlusion, you get better penetration of the actives, but if your client is uncomfortable having a rubberized mask, or sometimes in our cool peel treatments, we select the haze gauze instead, and we can cut a little hole for the nose and mouth if desired. Both will allow your crocodile clips to attach to them, and both are effective, just a little bit different in how they are applied and their performance. The pH treatment gel is also important in pulsed iontophoresis. Our ideal treatment period is 20 minutes, never more than 30 minutes. And if you have a DF1 or 2, we know we used to be able to go to a maximum of 2.0 milliamps, but with the generation of the DF3, Dr. Des has discovered that the milliampage does not need to exceed 0.5 milliamps. It will still deliver the same efficacy and results because it's the time that is most relevant, not the electrical current itself. Some of the contraindications for iontophoresis, and there's quite a few more than sono, are pacemakers and implants, pregnant or lactating women, epilepsy, open cuts or abrasions, cold sores or herpes, metallic implants of the face. So even if your client has really old dental work or fillings in the teeth, and the dentist has never changed them out from the metal to white, they may experience a little sensation with this. Botox and dermal fillers. So we know post-injectables, clients should wait a minimum of 2 weeks before having any facial or DF treatment. Sunburned skin, angina or arrhythmia, hemophilia or people who have blood clotting disorders, patients who have a history of stroke, and cancer patients or those undergoing radiotherapy. So of course we always want to complete a waiver or intake to make sure we have nothing in our treatment that will affect the health and safety of our clients. And when we're performing iontophoresis, they necessarily will not feel anything negative, but what they might see or visually see as their eyes are closed is pulsing or flashing lights. And again, some people see this more than others, some not at all. In terms of the combination of low frequency sono and iontophoresis, what do we have? Well, faster and better cavitation, resulting in improved product penetration and enhanced penetration of non-ionizable molecules. So I think this graphic on the next slide shows this very well. This is the trademarked technology, and I say that with pride, of the DF. So this particular graph just talks about the penetration of product, okay? So the graph depicts the penetration flow of molecules over time using the low frequency sonophoresis combined with the pulsed iontophoresis compared to low frequency sono and pulsed iontophoresis only. So first, laboratory results show that pulsed field iontophoresis provides 4 times better product penetration over a period of 20 minutes. Iontophoresis needs to be continued for a minimum of 8 minutes, up to a maximum of 20 minutes, as ions only start flowing effectively at the 8-minute mark. In our next click, we see that laboratory test results show that ultrasound, or high-frequency sound, provides 1 to 2 times better product penetration at a frequency of 1 to 3 megahertz over a period of 20 minutes. And 40 times better product penetration is achieved when low-frequency sonophoresis at 22 kilohertz is combined with pulsed iontophoresis in 15 seconds. Environ recommends the sonoprobe is held in one position for 15 seconds for the duration of treatment. So this just talks about how the penetration potential of the DF technology can positively affect the skin. So let's just look at a few before and after photos. So our first candidate here had 24 treatments with the 20% Vita C micropeel and retinol 1 using sono and iontophoresis 2 times per week for 3 months. Her home care recommendation was the Youth Essentia A range, and we see a definite improvement in the texture of the skin and the sagging of the skin. So the client's concern, of course, with aging was skin laxity and general texture and smoothness. And this was just after 3 months. Next, before and after, was a client who had 24 treatments between 1998 and 1999 with the 20% Vita C micropeel, again using sonophoresis and iontophoresis. She had the Youth Essentia A range for home care use and continued Environ DF treatments in 2001 and 2002. And the focus was really the wrinkles on her neck, because our neck and décolleté don't have oil glands, so the signs of aging due to sun damage and extrinsic and intrinsic factors give us that really pronounced line and texture change as we age. The client had a facelift 1 year before the first picture, and the second picture was taken just 2 months after she completed her iontophoresis and sonophoresis treatments in a 4-month period. She did go on a 1-month holiday during this course, but again, look at the difference between 1998 and 2002. It's like a whole new young skin. Here we have a client who had regular treatments with the DF machine and hydrating serum. She now has improved overall glow and luminosity of the skin. The skin appears more plump and dense. And of course, general improvement in the overall sagging of the skin. So we had an improvement or reduction in skin laxity. And if you even look at her cheek area, you see less broken capillaries. Even the vein under her eye and to the side of the eye is less pronounced. And we have a client here, regular treatments with peptide serum. So of course, we know the eye area is the first area of concern where we see those crow's feet due to also expression and microtensions in the eye area. So after 3 months of treatment, we see a definite improvement in the wrinkle depth and the crow's feet around the eyes. And finally, we have a body testimonial here. This client was concerned about the overall texture and color of the skin as well. We have a little bit of cellulite. So using the body probe with sonophoresis and iontophoresis, paired with the professional body profile gel, after just 6 treatments in 2 months, we have a huge improvement, reduction in dimpling of the skin. And again, the overall glow and luminosity of that thigh is much better. So that is our presentation on the DF3. In our future lessons, we'll talk about the different treatment experiences, professional products, and protocols.